Hello guys, how are you? How's everything there? I decided to change the environment a bit and to talk a bit in a different scenario, so you wouldn't associate me with my room only, that obviously needs a painting for a very long time. Here we are. I am charging because today is not my good day. Honestly, I feel like crap. I feel super foggy. It's hard to focus. I didn't think that it's a good idea to record anything, but I decided to give it a try. Let's see. In the worst case scenario, I'll just stop and go home rest. I needed to do something productive. I'm getting crazy sitting on my ass and doing nothing, and I need to get some fulfillment. So I will try to do this video. And in this video, I wanted to talk about something that helped me a lot, and I will do the same. And what I mean is, we will talk about the unpleasant situations around the surgery. And it may be crazy. Some people may say, why do you even want to talk about that? You're looking for attention, or it can be a very nice bait to make people watch this video. But honestly, the fact that I watched some stories of people who went through open heart surgery, and I have seen those unpleasant, painful moments, made me ready. And in my journey, some of those things, they turned out to be nothing. Some of the things were surprising because they didn't happen. I didn't expect them. And every journey, every surgery is different. Every situation is different. My journey, my surgery was, for me, unique. And I decided that I would go through all of those unpleasant situations with you. And perhaps if you are getting ready for the open heart surgery, listening to that will make you more ready. I started very negatively. Oh, I feel foggy, I feel tired. Yeah, that's normal. The first month after the surgery, it's like this. But in the same time, I don't feel a lot of unpleasant sensations that I had before the surgery. So I'm full of hope that in few weeks, in few months, I will be those side effects of the surgery will wear out, and yeah, we will roll. So the unpleasant situations. The first one, I went to the surgery without premedication. And what does that mean? This is my fourth surgery in my life. I had 2 surgeries for my knees, 1 surgery for my sinus. And each time in the morning before the surgery, I got a little pill that made me feel a little bit funny. Sometimes I was barely even registering what is happening. Sometimes I was just looking at the wall, pretty dumb. And that was necessary. That was a good thing. And I'm very thankful that I could feel like this, because what's the point in stressing just before the surgery? There's no point. And this funny pill that I was getting helped me to relax. This time I didn't get that pill. I didn't get a premedication. I went to the surgery room dry, let's say. And that was a scary experience. And this is not what I was expecting. I didn't even talk about that with the nurses or with the doctor, because I know this was all pretty shaky just before the surgery. Everything was happening so fast. My wife was with me, we were talking, and theoretically I could ask about that, but I forgot. Going there through the hallway on the bed, laying down in the surgery room, which is very cold, a lot of people, I'm almost naked. I see the machine next to me that will pump my blood in a few hours, and that's scary. And it's not like the scale from 0 to 10 of horrible things that may happen to you in the level of fear. I would say it was like 5.5 out of 10. It's not that terrible, but it was scary, and it took me some time to for my body to process that. Obviously, I fell asleep with that. I got my injection. I started to feel very nice, cozy feeling, traveling throughout my arm all the way to my head, and then I was gone. But when anesthesia, when morphine stopped working, I needed some time to digest that. to get along with that. So yeah, that was the first one. The second one that I was expecting to be much worse, but for me it turned out to be 0 out of 10. When I woke up with the tube in my throat, and that's normal. What is that? I saw videos of people waking up from the surgery, and the process of removing the tube was seemed like pretty unpleasant, pretty painful, pretty disgusting. But in the same time, a lot of people didn't even remember that after this, after the anesthesia wore out. So I was like, okay, I'll probably not remember that as well. I remember that, and that was a pretty bizarre feeling, because when I woke up, I felt like I don't breathe and I'm fine. I tried to take few breaths and it felt comfortable for some reason, and I felt cozy after waking up. And yeah, a nurse noticed me. She asked me to show a few fingers, I think. I did that, and they removed the tube, and there was no pain, there was no discomfort. I was a little bit surprised that it was so long, but honestly, 0 out of 10. 2 days later, I noticed that I have a little sore throat. That's it. So this one, for me, no problem. No pasa nada. The third unpleasant experience in the hospital around the surgery was pretty silly, but it was a pretty big deal for me, and it affected my regeneration and comfort, and it was the fact that the bed was too short for me. And in reality, it was not too short. There was an option to remove this support for the leg, this like the barrier of the bed, to just push it away. But no one did it until the day 4. Only on the 4th day, my doctor came to see me, and she asked me, I had 2 main doctors, she asked me, how am I, why don't I adjust the bed? She did that for me, and then it was amazing. And it helped me a lot. Honestly, for the first 4 days, I was sleeping with 1 or 2 legs outside the bed. You know, I don't know, nurses maybe thought that it's comfortable for me. I didn't really, I didn't know that that's an option, to just move the part of the bed away so I could sleep more comfortably. I should ask for that in the beginning. And since then, the quality of my sleep improved a lot. I was like, okay, now we relax. So this uncomfortable experience, I would say it's 3 out of 10, even 2.5, let's say. But it's just the discomfort, you know, it's like I could fall asleep anyway. Just a silly, stupid thing. It's always worth to ask, you know, if something bothers you even a little bit, it's always worth to talk about that. Fourth one. The fourth one was about the drains. I woke up with 2 tubes in my stomach. They were here, 1, 2. I have a nice scars after them. One is attached. Then was one of them was going all the way to pericardium. The second one to the pleura. I hope that I didn't miss the pronunciation. So the outer layer of lungs, and it's a very necessary thing. And unfortunately, it's also uncomfortable one. And I realized this uncomfortableness only on the 3rd day, 2nd day, somewhere in between, second, 3rd day after the surgery. Before, I was on medications, I was a little bit fuzzy, so I didn't bother that I have 2 cables there. But at some point, I realized that massive portion of my discomfort, of my pulling, what I feel when the painkillers were out, are those cables, that this is my main discomfort right now. And they were removed on the 3rd day. Until then, I would say, oh yeah, they were limiting me in the capacity of breathing, moving my hands. Standing was very uncomfortable, and having them inside, I would say I didn't feel pain because of the painkillers. Maybe slight pain were at the moments where they were wearing out. So having them, I would say it's 3.5 out of 10, reasonably. Removing them is quite a journey. Honestly, I would say honestly, 7 out of 10, but only for a few seconds, 2 times. One was 7 out of 10, the second one was 5 out of 10, because the one from pericardium didn't hurt that much, and it was shorter. I asked for the painkiller, for the drip with the painkillers, 10 minutes ahead, when I knew that that was the tip from the nurse. She told me, when they will tell you that you will have the drainage removal, tell me, we will give you painkillers 10 minutes ahead. And that was very helpful. Placing the suture, I had, because of one of the sutures, a little bit of a back pain for the next few days. When they were placing one of the sutures, I felt like the tissues were pulled here, and I had a little bit of a back pain because of that, because it was kind of affecting my posture. After they removed that, after I did a little bit of mobilization there, everything disappeared. So this was the next one. I guess that's the moment to tell you about the worst one, the worst experience after the whole surgery, around the whole surgery. The most problematic two situations were like this. And let's talk about that. The first one, the worst experience that I had, was when I was overloaded with morphine. And it's not the fault of anyone. I am sure that nurses were giving me the dose that was prescribed, that was supposed to be safe for me. I should be able to digest that, but at some point it turned out that it was too much. Maybe some sensitivity, I don't know. I never had a problem with opioids around the surgery, but this time, unfortunately. So when I was on the intensive care unit, where I stayed the first 24 hours after the surgery, I was getting shots with morphine from time to time. And I was getting them every few hours. At some point, I noticed that just after the injection, I don't feel very well. Like I feel something squeezing, like the discomfort, that I feel like something is choking me. It lasts for a moment and it disappears. The first time I didn't really know why is that, what is happening. The second time I already was sure that this is because of the morphine, and I mentioned to the nurse that I don't react well, and then I got the dose decreased for quite some time. The nurses told me that we will watch out with that, but the next time I got the morphine, it was too much. There was no pain. I cannot describe that experience in the sense of pain, in the measurement of pain, because there was no pain. This was just a discomfort, squeezing, heaviness, pulling, and all sorts of unpleasant sensations that made me crunch my jaw, tighten up. I grabbed the bed. I was expressing very unpleasant noises, and that was easily 9 out of 10. Like, it's hard to imagine anything stronger. I am sure that there can be a harder discomfort, but this one was easily 9 out of 10. The good news is that it lasted 8 minutes, honestly around 8 minutes, and then it disappeared very quickly, instantly, and I lay down and passed out. So later I had to work on my jaw a bit and my temples, because I tightened up so much that I had a pretty big headaches. I am not angry at anyone. It's just 8 minutes. No, it's like nothing. Even though it was not nice, it didn't last long. That's it. Happens, right? Another unpleasant situation that I had on the ward 0. It's called. This place is a place where they took me from the intense care, and this is also kind of an intense care, but not as rigid, let's say. This is like a transition place between the intense care unit and the regular room where you chill. And then I started to have shortness of breath. That was pretty scary. Just randomly, I started to feel like I have not enough air. That was around 7 out of 10, let's say, in the scale. And I asked the nurse if everything is all right, if everything is fine with me. She told me that my vitals are pretty much fine. So what to do? There is no pain. vitals are fine. So I was laying down there, and I was thinking that if it will last, I'm screwed. Like, I'm in big troubles. If it will stay like this for a few days, that's bad. Fortunately, it lasted 10 minutes. It disappeared and came back a few times, but with the intensity of 10% that I experienced then. This was just a single episode, and I was not the only one on that ward, in that room. One guy told the nurse that he is dying, that he is floating away. The nurse told him that his vitals are fine, nothing to worry about. And after 20 minutes, he was talking on the phone with someone, chilled. So, yeah, the worst two experiences that I had around the surgery, they lasted less than 10 minutes. If you plan to have an open heart surgery, no worries. There will be hard moments, but honestly, they pass. Few minutes. Just wait for that. Have that in mind. That was the biggest challenge. This thinking that if it will stay like this, that's a big problem. And the last unpleasant thing that was due to the surgery, due to the situation around the surgery, actually happened quite later. And it was a small infection on the wound after the drainage. It wasn't a big thing, but it affected my mood, and it made me feel pretty bad for around 2 days, and I didn't know where it's coming from. I felt anxious, I felt that my energy is very low, I was angry, I was not happy, I was pretty just restless and shaky, stuff like that, and I didn't know why. And it turned out that it's because of the scar. And so the drainage scar was made, let me show you here, this way, that they used the suture to close that this way. And from outside it looks fine. There was a scab here. When the suture was taken out, it turned out that the sides of the scar, of the wound, they didn't look well. It looked, there was something yellowish, and yeah, it looked that it's not healing very, very well. And after disinfecting that and waiting a bit, I felt much, much better. Like, my mental clarity came back to some extent. I felt like I got my life back. The infected wound really can mess up the mood, and it messed up my mood big time. This one will be the last, pump head. So something that I still struggle with, or basically the fact that your blood is circulating for some time outside of your body, is causing your nervous system to be a little bit micro damaged. And it's probably a little bit because of that, because of the inflammation, because of the fact that a lot of metabolism processes are affected. And pump head is a temporary decrease in mental clarity, in short-term memory, in focus. And I noticed that. I would say that it's around 2 out of 10 discomfort. I noticed 3 or 4 days after the surgery that I have memory gaps of the things that happened before the surgery, and that was pretty shocking. All right, and that's food for bisons or what? I'm not sure. Should I be here or not? What's that? If this is my last recording, if some wild animal will catch me. Hello to everyone. I hope that my last video helped someone upload it on YouTube. And that's beautiful here. The pump head should disappear 3 days, up to 3 months after the surgery. I'm taking supplements for the nervous system. Hopefully it will be gone soon. It is causing me to not feel good with myself sometimes, not gonna lie. I forget about simple things. It's not as bad, I'm telling you. It's not like so terrible. It's really not that bad, but it's not very pleasant either. These were the unpleasant experiences, and I guess that's everything. Some people may have a problem with roommates, with people who they share the room with. I didn't have that problem. I shared the room with very cool people, very nice people. The staff was awesome. Doctors, nurses, cleaners, everyone were amazing, and the hospital was clean, everyone was professional, and I was sure that I'm in the best hands possible. So this is it. And honestly, after saying all of that, it's not that bad. The biggest problem was here. The biggest problem was the stories that I was telling myself from time to time. That's it. The experience itself, everyone can manage this experience. I'm sure about that. It's not a big deal. It doesn't last. So hopefully you don't delay very important surgery that may enhance your life, that can save your life because of the fear of those things. This is something that I realized while laying there. I heard stories of people who have friends or family members that avoid having a surgery because of the fear. So hopefully, if you had 4 or 5 consultations about the surgery, and everyone tell you the same way, you need to undergo something because you may end up very badly. From my heart, I'm telling you, if you have to, and you are sure that you have to, you will manage that. Yes, I'm 30. I don't have any other health issues. I don't smoke. I don't drink. I'm physically active, but that's an excuse. I saw people at that ward having, okay, not mine, not septal myectomy, but different kinds of surgeries at the age of 60, at the age of 70, with big bellies like this, and and they were fine. Yes, there are risks. I took them. Everyone who goes for the surgery takes the risk. A lot of things may go not so well, but in the same time, the technology right now is amazing. When I watched the videos of people who had a surgery 15 years ago and who have a surgery right now, that's a major difference. I was able to talk through the phone on the 48 hours after the surgery. I was able to have a proper, normal phone call. Really, after the heart surgery. Imagine that 15, 20 years ago, you would have to wait a month. I was watching the story of a guy who was waiting a month before he was ready to talk through the phone. Imagine, we are in a very good place. We are entitled. Obviously, it hurts me a lot that this kind of possibility is not available for everyone because of the insurance, because of the money, because it may not be available in some parts of the world, and that's a shame. Accessibility is a massive problem in healthcare. That's bad. Guys, thank you very much for listening. Hopefully it helps someone. If it will help one person, it was worth to record that, edit that, and upload that. If you have any questions, let me know in the comments. And I go to enjoy my walk. See you guys.